For many people, they'll know Alzheimer's as the irreversible disease. What is the best hard evidence that we have that suggests that is not the case?
Yeah, well, my clinical experience, my research experience has been that people with diagnosed Alzheimer's, and there's a lot of gray area in this diagnosis of Alzheimer's, and particularly over the past several years, it's really changed because of the labs that are now available outside of the research space. But what I've seen in my clinical experience is that people with including people with diagnosed Alzheimer's, also others with mild cognitive impairment and on that path towards Alzheimer's, have been able to regain cognitive function. And so that I was also told that you couldn't reverse Alzheimer's, that there was really nothing that we could do to support or help someone with Alzheimer's or dementia. And then what happened was in my clinical practice, I saw over and over again that that wasn't true, that there were people whose quality of life improved, whose memory improved, whose short-term memory improved, whose executive function improved, whose language improved. And so when I saw that that was possible, and particularly the means by which it's possible, that's a really important piece of this. The side effects of this approach are that your blood sugar improves, that your hypertension, your high blood pressure improves, that mental health improves, sleep improves, your fall risk improves. So because the side effects are essentially general health, I think that it's important that people know that this is an option before we have huge, big randomized controlled trials available. I don't think we have to wait for that to tell people that this is possible. I mean, I've watched it over and over and over again in my clinical practice. And in fact, the majority of people who are able and willing to do the work that it takes to regain cognitive function do.
So over the years, whenever I've heard about, reversing Alzheimer's or these sort of topics, I've always been a little bit skeptical in the past because a lot of the evidence seems to be more anecdotal than hard data. But in your experience and in your research, what data have you seen or you've been able to get your hands on that really tells you that this is something worthwhile?
Yeah, so I think a lot of the perspective that this is irreversible, it comes from the paradigm of a single molecule is going to save us, right? This randomized controlled trial, the double-blinded placebo-controlled, that research is really, that paradigm really fits when you have a single molecule intervention, right? When you limit the variables and you have a pharmaceutical basically to test. Now, what we're suggesting is that it's much more complicated, right? All of the cognitive decline associated with aging, right? This memory loss associated with aging that includes all of the dementias, right? Not just Alzheimer's, but some of the others like frontotemporal dementia, vascular dementia, Lewy body dementia. All of these start with something above the kind of causes that some people talk about, right? Like the Lewy bodies themselves or the amyloid plaques that build up. There's something that creates a cascade of events that end in neurodegeneration. And when we look at that causal level, when we start thinking through the things that initiate neurodegeneration, things like toxin overload, high blood sugar, imbalanced nutrients, stressors, any sort of so I'll take you through those 6 components of brain health just briefly. It's toxins, nutrients, stressors, structural issues, signaling, and infections. And when we look at that causal level piece, what we can do is we can reverse the neurodegeneration. And so the research that I did in my clinical practice, this was a 6-month intervention. We took 23 participants who had measurable cognitive impairment. So this was tracked using Mocha scores, the Montreal Cognitive Assessment, to establish whether or not they were eligible. They met the criteria for inclusion. And then we also used the Cambridge Brain Sciences battery of cognitive testing. And over the course of 6 months, we did a Bredesen style. Dr. Dale Bredesen is my mentor. He wrote the book, The End of Alzheimer's, that was published in 2017. And that was when these ideas and concepts really started to get traction. And so we started this clinical trial in 2020, and then we had to stop for a minute let COVID kind of dissipate. And then we started up again and we published in 2023. Our results showed that 17 of the 23 participants who completed the 6-month intervention had an increase in their cognitive function on both Mocha scores and the Cambridge Brain Sciences. We also saw that the mean scores across all participants had statistically significant increases in Mocha scores, the Montreal Cognitive Assessment, and then as well as memory and overall composite cognition in quality of life and in sleep scores. So what we saw was we took impaired participants with Mocha scores between 12 and 23. So a normal Mocha is 26 and above. Perfect is 30. And as you're getting down in those lower levels, you're going in the direction of severe dementia or Alzheimer's. And we saw this improvement, an impressive improvement, really more than I expected. And part of the reason that the impetus for this trial was because people were asking me, if I do this, if I spend the money, if I make the effort, if I do this for my loved one or for myself, how likely is it to work? And I didn't know the answer to that. A year earlier in 2022, Dr. Bredesen and his group, led by Kat Tubes, they published a very similar trial. It was a 9-month intervention that took participants with Mocha scores down to 19. And they showed that in those 9 months, they were able to improve the cognitive scores of 84% of those participants. So even 10% more than in our trial, where we had only 6 months and we took participants with more severe impairment. And then just this year in 2024, Dr. Dean Ornish published his trial, which was the first randomized control trial. They took 49 participants, and some of them were in a control group and some were in an intervention group. And their intervention was slightly different. We use a ketogenic diet in the Bredesen approach. And in Dr. Ornish's trial, they used a vegan diet, but both reduce the amount of processed foods in their diets. And there was an exercise component, a group kind of therapy component, or a support group component, stress support. And that lifestyle intervention had a statistically significant difference and improvement in cognition in the intervention group compared to the control group. And that was actually just 5 months.
So in terms of the actual intervention itself, you mentioned some lifestyle factors there, the ketogenic diet, the vegan diet. What other factors are we throwing in? What does this intervention look like to the individual?
Yeah, great question. So I talked through those 6 components of brain health, and I think that that's a really great framework for us to use. Again, we're talking about the causal level factors when it comes to neurodegeneration. So too much toxicity is an issue, especially if it's accumulating in our brain. So part of what we're doing now, and there's a couple ways to organize ourselves here. And I think first, the framework starts with the foundation of these lifestyle interventions. And so we can get into the clinical piece of this, where we do a lot of testing and evaluation of the different causes. And that starts to add cost to this intervention. And really the meat of it is in these foundational lifestyle changes, which include, I'm a fan of the organic ketogenic diet, and then you don't get into ketosis forever, but 3 to 6 months if you're suffering with cognitive impairment, and then going back and forth with potentially a plant-based diet, but maintaining a very low consumption of processed foods, especially highly processed foods. There's a great book called Highly Processed People, and that really lays out what processed food is versus isn't. And then, so diet, exercise, participating in at least 200 minutes a week of moderate to vigorous exercise, some combination of strength training, aerobic exercise, and really getting into exercise where you're engaging cognitively at the same time as physically. So whether it's a course where you are cued by an instructor, that can be very helpful, or learning to play a new sport, learning to do something different, and keep staying engaged while you're exercising is important. And then sleep. Sleep is a huge one that's so crucially important to brain health. No matter what age you are, we've looked at the research. There is literature that shows that in our 20s, 30s, 40s, in middle age, and even before that, 1 night of sleep deprivation leads to a measurable accumulation of beta amyloid in the brain. And so we want to make sure that that's not happening night after night after night and leading to really significant accumulation that can put us at risk for developing dementia later in life. Now, later in life, getting a minimum of 7 hours of sleep with hopefully 90 minutes of REM and 60 minutes of deep sleep, this allows the brain to consolidate memories, to take kind of the bite out of stressful situations. We get this emotional regulation through our sleep. And then also we get the benefit of the glymphatic rinsing of not only amyloid, but also other toxins that can build up through the night and through just general metabolism through the day. So we've talked about diet, exercise a bit, sleep. Stress management is another really big one. And again, this kind of comes back to more of a balance, right? It's like too much, too little in the wrong place at the wrong time of any of these things can be detrimental. But getting purpose and meaning, having a reason to get up and get out of bed in the morning, that is as important as not being overwhelmed. We see that caregiver burden in the space of Alzheimer's, people who care for a loved one with dementia are anywhere from 2.5 to 6 times more likely to be diagnosed with dementia later on themselves. And so to reduce that risk, we talk about taking on this protocol, this program, this lifestyle as a way to reduce the risk of that burden. So you can see how excess stress, whether it's from working night shifts or just having cortisol raised over time is toxic to the hippocampus, that memory center of the brain. The amygdala and the hippocampus, that kind of emotional center and the memory center, very closely intertwined. And so we can't fully separate them. Good emotion helps us to learn and rewire and create new memories. And then the negative emotion can help us to actually can be detrimental, right? Can not help us, can really be a disservice. And so stress management, whether it's through prayer practice, gratitude practices, meditation, there's a great body of literature around Kirtan Kriya as a meditative practice specifically beneficial for dementia and many of the risk factors around dementia, high blood pressure, obesity, high blood sugar, immune function, many of the things that we kind of think of as having this causal level role is mitigated through a meditation practice.
Wow. So there's so much there to dig into, and I'm sure we'll make our way around the houses. But for the people listening right now who, like me, they've been skeptical of this in the past. It's not something they've ever been taught about until they clicked on this podcast. And I imagine a few people who have clicked on this podcast are probably those who have personal reasons to do so. They may have loved ones going through this right now. They may have something that's happened in the past that makes them worry about their future. What would you say to those people who are, I would imagine right now, going through pain, or they don't really see a way out of a certain situation, and they're saying, please don't give us false hope unless you are sure about this, that it is worthwhile. What would you say to those people?
Yeah. So I think one thing is this is common sense. It's just uncommon practice, right? Like when you look around and you look at how healthy someone is aging, you can see the people who have chosen to get regular exercise, who have a prayer practice or a meditation practice, who eat good, clean food. You can watch how they're aging in a different way, right? So I think that this is very apparent to us if we take a moment to look around at what our personal experience is. Second is it's not for everyone. Right? So you don't have to do this. I'm not here to convince anyone. I'm here to share what I've seen in my clinical practice and our residential experience we have an immersive experience where we do this. And then also in the coaching programs, the people who are willing and able to do the work, because this does require work, right? This is about making changes, and it's hard to make behavioral changes no matter what age we are, but particularly when we have cognitive decline, right? When we're set in our ways and we're older. And so this isn't for everyone, and that's okay. What I think is criminal is that not everyone knows it's an option, that people are still told there's nothing you can do. And that is actually false hopelessness. Right. So that is, I think, really the narrative that I am attempting to shift because of what I have seen with my own eyes over and over again. And then what we've measured and published. And so for those who, are in the camp of I'm going to wait for a medication to pop up that is a pill I can swallow or an IV I can take. This isn't for you, and that's okay. There's no judgment around that. That is totally okay. Live the life that you were meant to live and that you've dreamed of. If that means kicking your feet up and watching TV and enjoying a happy hour every afternoon in your retirement, that is your prerogative. I am not here to judge that. And if you're someone who is ready to figure out and learn about all that you can do and make changes and put in the effort so that you can retain and enhance and optimize your cognitive function no matter where you are on this path, then we have so much information to share with you.
So let's go back to the examples you've seen firsthand. What is the most, I don't want to use the word miraculous, but what is the most significant change you have seen in one person? What is the story? What is the person that comes to mind?
Oh, there's so many fun ones. Yeah, so Darlene was the first patient I saw, and I think it's so significant because she changed my life and my purpose in life, and really invited me into this world because she was the first patient I saw shift dramatically. So she came in with a Mocha score of 2. So again, normal is 26 and above. Perfect is 30. So it's a 1-page worksheet. The Mocha is the Montreal Cognitive Assessment. And she had a Mocha score of 2. So her husband had brought her in because she was completely dependent on him. When I would ask her a question, she would answer with yes or no, maybe. And oftentimes I would ask a question, normal doctor questions. What did you have for dinner last night? Are your bowels healthy? Are you exercising? Do you have any pain? And you could see the wheels spinning in her mind, but she couldn't retain the question long enough to also come up with an answer. Her handwriting was cramped and illegible. And she really loved to get dressed. She loved clothes. I guess she always had. She had been a school teacher, and her husband was saying that that was one of the things that she could engage in, was she would play dress up in her closet, and she would spend a lot of time in her closet. And she had this huge smile, and you could tell that she was in there somewhere, but she could barely answer questions. She was 100% dependent on her husband. And this had affected both of their lives significantly. And so he had read Dr. Bredeson's book. I saw them in late 2017, early 2018. And they went home with much more confidence than I had. And he put all of it to work. They had her dental work done because we know there's a connection between toxicity that can come from dentistry, and then also from gingivitis. And P. gingivalis in particular can trigger amyloid plaque production in the brain. So she had all of her dental work done. She got on bioidentical hormone replacement. She started on detox processes. They moved out of a moldy bedroom, and they actually just moved into their living room. And they started ballroom dancing 3 times a week, even though they weren't very good at it. They just got started. They were walking every day. They got on a ketogenic diet. They started the supplements. And she came back just 6 weeks later, and her Mocha score was a 7. So this was a massive improvement. And the first thing I thought was, it was disbelief. I was like, we must have measured it wrong. This isn't supposed to be possible, right? I've learned for years that this is impossible. So what is going on? And I looked at her husband. I was like, wait, what? And he's like, no, this is happening. This is real. She is better. And talking to her, she was able to formulate sentences. Her handwriting had changed. It was this big looping school teacher handwriting had come back. And their lives, they were significantly changed. She was able to communicate with her husband. She was not going back to work. But what I saw for her that day, for Darlene that day, I couldn't do anything else with my life professionally after seeing that was possible, right? Because if that was possible for her, starting with a Mocha score of 2, then what about everybody else who was not even close to that far gone? What could we do for them? There is so much suffering that can be prevented if we can intervene earlier. And right, she went from a Mocha score of 2 to 7. And again, she's not going back to work. They're still having to put a lot of effort into this, but it's better than 2, right? Where she can't even communicate. So and I think for every family, the dynamics are different. Her husband was completely dedicated to getting her better in by whatever means possible, right? Not everybody is going to be in that same situation. There's different constraints. There's effort and time and financial and all kinds of things that come up. Not everybody can do that. But when I saw what happened for her, then it was immediately, okay, who else can we do this for? What else can we do? And there have been people there is another woman who I saw and I share in the book. She came in as a last ditch effort because she had no living family other than 2 second cousins who lived a couple of hours north in a senior living community. And the way that it was set up here is that basically you could move in at one rate. And then you could stay at the same rate no matter what you needed. It was like an age in place model. And you could only move in if you had no measurable cognitive impairment. So she had some measurable cognitive impairment. So she wasn't eligible to live where her only distant relatives lived, right? And so she had this fear, horrible fear. She was so anxious of dying alone, demented in our house. And she was moved really by desperation. So she joined our clinical trial, and my health coach who was on our team, she reached out and she was like, this woman is like not ready for this. She can't do this on her own. She's so anxious. She was calling us multiple times a day. My staff literally had to put aside time on Mondays to listen to all the voicemails that she left over the weekend. And like, if you could think of like someone needing their hand held, she like needed both hands held all the time to get through this. Like, is this safe for me? I'm not sure. Should I really do this? I don't know. And 6 months later, she like came in dancing. She's like, I don't have time to see you. I don't need a doctor. I'm out dating. She'd like got her taxes done for the first time in years. She'd cleaned up her house. And a really big part of her story that I find super inspiring is that I think what kept her going, because it gets hard, right? Like you run out of motivation, and you have like, it's the cooking and the shopping and the exercise, it's work. And she loves ice cream. So in the middle of it, and at about the 3-month mark, one of her neighbors was diagnosed with cancer, and she started cooking for him, not only herself. And making it about someone else is, I think, what helped her to sustain the effort. And that was a really just like a neat observation, I think, in her case, because again, she started with like a readiness score of 0. Like everybody was like, don't let her in your trial because she's going to mess up the data. We don't think she can do this. And then she was this miracle. She was just so incredible. And she's, again, the personalities and the people that we get to meet, it's such a privilege because they just like show me what's possible and how much fun life can be in that like last quarter of it.
Yeah, that is a really beautiful example. You referenced the Mocha score. How do you determine that? What does that process look like?
Yeah, the Mocha score, it's a blunt instrument, right? It's a screening test for cognitive impairment. It's a 30-point. Many people maybe are familiar with this. If you've had a family member with dementia, you copy a cube and you draw a clock and you name some zoo animals. It's a 1-page worksheet. Now, the mini mental status exam, the SLUMS test, there are others. And then oftentimes if you engage with a neurologist or even primary care in the US anyways, they'll send you for neuropsych evaluations, which are long, like 4-hour tests. And that can be another way to get more information about what type of cognitive decline you're going through. Those can be very stressful, and they don't always change the course of treatment, right? So we tend to focus on we use this blunt instrument. The Cambridge Brain Sciences test is a more sophisticated one with more questions. There's this battery of testing with different, basically there's different subsets, like there's focus and verbal ability and executive function and memory. And we saw that we were getting pretty similar data between the Cambridge Brain Sciences and the Mocha scores. And so for our patients, it's much less expensive to do a Mocha score, and it gives us that feedback. It's a measuring stick. Am I the same as I was 3 months ago or 6 months ago or 12 months ago? Am I getting better? Or am I getting worse? It's a way to put a number on that. But really what matters to people is, can I do my laundry? Can I cook for myself? Can I go to the bathroom on my own? Can I buy my grandkids Christmas presents? Can I drive? Those are really the meaningful things that matter to people. And then the Mocha score is a way that we just kind of put a number on it so we can communicate between practitioners, and we have this like measuring stick.
We've mentioned a few times already that the sort of the narrative that we are always taught is that this is irreversible. It is that it's something you don't have much control over. It's almost a sort of a predetermined fate. That is the mainstream narrative. When you're in school, a lot of doctors, any, big movies that have been made about dementia. I'll lose any street cred I ever had, if I had any. But The Notebook, one of my favorite movies, that's all about managing this disease, right? And just helping someone along the way rather than doing anything to combat it. Then, if this data that we're starting to see now is so undeniable, and these case studies are so undeniable, and we can see them. Why do you think this isn't more of a mainstream narrative? Why does it take someone like you to write a book and come on podcasts to teach people about it?
Yeah, I think that is changing. So here in the US in June, Sanjay Gupta through CNN did I think it was the last Alzheimer's patient. He was the name of the special that they did. So I would argue that this actually is becoming more mainstream. There was a Time article that came out right after Dr. Ornish published his paper. And so I think that the narrative takes time to shift, right? We've been sort of told over and over and over again that this isn't possible. And it's, easy for the status quo to persist. But I would say that this is happening. This is changing.
Well, that's good. So how much, in your opinion, is something like cognitive function, how much of our cognitive functional fate then is in our own hands, and how much is predetermined for us?
Yeah, so the Lancet Commission report was just updated this summer, and so there's a commission report. There was the initial one came out in 2017. There was another one in 2020, and then in 2024 they updated it again, and they suggest that 45% of worldwide dementia cases could be prevented, and I think that number is actually quite higher. So they list about 14, 15 modifiable risk factors when it comes to Alzheimer's and dementia. They added 2 new ones on this recent update. And so I think this is very well established that dementia is preventable. Many dementias are preventable. And there's so much that we can do. And I think it's unfortunate, right? Like you have heard this over and over again, and you keep kind of bringing this up, but we're told there's nothing you can do. What the Lancet Commission report has been saying since 2017, that there's a whole laundry list of things that we can do. So genetics is a component, right? That there are people who are at a higher risk, but if we know, and it's so easy and inexpensive to get our genetics, we can know our ApoE status. So maybe we should break that down really quick. So I mentioned structure is one of these components of brain health, and a modifiable structural issue, right, is traumatic brain injuries. We can avoid getting traumatic brain injuries. We can choose the sports we play. We can put our seatbelts on. We can do things we can wear helmets. We can do things to reduce the risk of traumatic brain injuries. We can address our sleep apnea, which I think of as a structural issue. That's when we're blocking off our airway. We can address vascular dementia by reducing our blood pressure, modulating our blood pressure so that it's optimized, and our cholesterol levels as well. Those are 2 things these are all actually on the Lancet Commission report. Genetics is an unmodifiable risk factor, and this is our molecular structure. We cannot change our genetics. We can't change the year we were born. We can't change whether we're female or male, and females are at higher risk. They are 2 out of every 3 dementia patients are female. And ApoE, APOE as an elephant, that is one of these genetic markers for cardiovascular risk and for dementia risk. So you get 2 copies, one from mom and one from dad. And stay with me here, this gets a little bit confusing, but the copies are named as numbers, 2, 3, or 4. So there's no APO1. It's just 2, 3, or 4. And the majority of us have ApoE3. However, if you have 1 copy of 4, so if you have, say, a 3 from one of your parents and a 4 from the other, your risk goes from 13%, which is the general population, 13% risk of developing Alzheimer's, to 30%. So it goes up by almost 3 times. And then if you have 2 copies of ApoE4, one from mom and one from dad, your risk goes up well over 50%. And there was a recent Nature paper that came out that suggested it was almost inevitable that you would get dementia in your life, Alzheimer's in your life, if you were ApoE4 positive. Now, that being said, the Lancet says there's 14 modifiable risk factors. So if you know in your 20s that you're ApoE3, 4, or 4 positive, then you can look at that entire list and you can start pulling every lever as hard as you possibly can to reduce your risk of developing Alzheimer's later in life. And that's the invitation.
There's a lot of people who, as we've mentioned, will have family members. In my case in particular, a family member of mine, I watched go through this, which was horrendous. But it does make you worry and contemplate your future. and, where you're going to be at that age. So you mentioned that. So what are the best ways we can test if we are someone who's at higher risk? And outside of actual testing, are there any early indicators we can look out for that aren't a actual medical test?
Yeah. So what I would say is, the symptoms, those early symptoms of Alzheimer's, things like not being able to find words, that's a real names and words, misplacing things, phones, keys, wallet, that kind of thing, misplacing things more than normal, having kind of a change in your judgment, particularly when it comes to managing things like finances or falling victim to fraud, is often an early sign that someone is experiencing cognitive decline. There are a handful of things like that. But that being said, that's almost later stage because the changes in our brain start happening oftentimes decades before there's any sign, any symptom of dementia. And so if we are feeling like we might be at risk, then looking at things like our ApoE status, so understanding our genetic predisposition, you might actually be very relieved to find out you don't carry that gene, that you are not genetically predisposed. That can be a huge relief for many people who have family members that have suffered with Alzheimer's to say, oh, I don't actually have that. Great. Maybe I'll have other things, but it probably won't be that. Less likely anyways. And then two, there are now, this has changed just in the last, just this year in 2024, we now have access to markers like p-tau 217. So this is phosphorylated tau that can tell us if those structural changes in the brain are starting to take place before we have any symptoms. And if that's happening, then we can get ahead of that by making these lifestyle changes and then getting into maybe even the clinical side of things where we measure. Are there elevated toxins? Can we identify nutrient imbalances? Can we optimize our blood sugar and our blood pressure and all of those things? Let's get the testing done. What about our stress? Is our cortisol too high or too low? Are we burnt out? What about our hormone levels, our thyroid, that signaling? Do we have enough vitamin D? Do we have enough thyroid? Do we have enough sex hormones to signal to the brain to be in that regenerative mode, that healing mode versus that fight and defend mode? What about infectious burden? Do we have a high level of P. gingivalis or herpes simplex 1 or COVID? Has COVID happened over and over and affected our cognition? Or even Lyme, the Lyme spirochete has a neuro presentation that can affect cognition. So we can look through these things systematically with the trained provider and understand, are there, again, modifiable risk factors in that category where we can address things, eliminate them, and help to get that brain into a more regenerative state.
So I mentioned that someone in my family has had this, and so I may worry, but there might be people listening who are thinking right now, no one in my family has ever had it, so I'm probably not going to get it. Is it not that black and white? Would you encourage those people to go out there and do these tests anyway?
Well, I would imagine that, your couple of answers there. One, I'm sure that your audience is extremely well educated and they're looking to optimize their health. And so I have a friend, Dr. Kara Fitzgerald. She is in the aging space, right? In the healthy aging space. And we kind of joke like, oh, our suggestions are the same, right? What we're talking about at a foundational level, lifestyle level, and then even as we look at the kind of the functional medicine interventions, what we're talking about here is, again, it's common sense and it's directed towards healthy aging. And yes, there's a brain spin on it. And we're speaking more directly to the people who are concerned about Alzheimer's and dementia. But getting exercise, staying socially connected, managing our stressors, optimizing sleep, optimizing our blood sugar levels and our nutrient intake, those are all things that we want to do to age gracefully generally. And I think the well-educated kind of population who listens to your podcast, I would hope that this feels inspiring and also like something that these are things that can be done to optimize cognitive function, right? I'm sure many people listening can relate to being jet lagged and feeling like your brain doesn't work when you haven't gotten enough sleep or you're in the wrong time zone. That feeling, like we don't want to have that as we age. And so what can we do to optimize sleep so that we optimize cognition so that we're on, whether we're parenting, or we're showing up at work, or we're showing up in relationships, whatever we're doing, when we have these foundations set, we show up as our best selves for as long as possible, right? We're not as prone to the inflammation and the mental instability and the scares of heart attacks or strokes or other things that might affect us as we age.
You mentioned it with our audience. A lot of our audience are quite young. They're youthful, they're energetic, they're in their sort of physical peak, their mental peak. Is there at any age where it's maybe too early to think about this, or should you be thinking about this even when you are in your peak? Is this something that we should be thinking about early doors, early adult, early 20s, or is this something that people don't have to worry about until maybe the 30s, 40s? Is it too early of a time, or is there no time like the present?
Yeah, there's no time like the present. The earlier, the better. It's so much easier to prevent than to reverse this disease. I have no question there. It takes much less effort. I think that if you have family members who you're genetically related to who have suffered, then I think it's worth looking now at your genetic risk and then starting to make these changes, starting to make these behavior changes now, setting yourself up for optimal cognition. We see that people who are ApoE44 positive, there are changes in your late teens and early 20s in your cognition compared to those who are not ApoE44 positive. And so the time to start is now. The other thing that we often see happening is that younger people can share this with an older audience or older family members. And sometimes it starts there, like, oh, mom needs to hear this. And then, if the 20, 30 something adult child is interested, one of the best ways to show mom how well this works is to model it, right? That if you are optimizing and prioritizing your sleep, if you are participating in some sort of mindfulness practice, if you're getting exercise regularly, if you are eating a healthier diet, engaging them around that, inviting them into it, but not shoving it down their throat. Or banging your own head against the wall, trying to convince someone else that it's really about modeling this behavior and then gently inviting them into the conversation.
So outside of the factors like diet, exercise, is there anything to the old saying, use it or lose it? And I mean things like mental tasks, reading, challenging yourself mentally. Maybe those people out there who now they're into adulthood, they settle into this routine of maybe go to work. Maybe they have a quite laborious job that doesn't require much critical thinking. They come home, they're watching the TV, they go to bed, they do it all again. Is there something to challenging yourself mentally to, help prevent cognitive decline?
Yeah, without a doubt. So you want to enter those later years with cognitive reserve is what we say. And one of the modifiable risk factors when it comes to dementia, as described by the Lancet, is early childhood education. But then extending that education into adulthood, being a lifelong learner, is something that we see reduces the risk of dementia. So the more education, even the more formal education you get, the lower you can reduce your risk of dementia. Now, that being said, it doesn't have to be formal education, right? You don't have to continue pursuing degrees. You can learn to play new sports. You can learn a new instrument. I highly recommend when you go to learn something, right? You want to do bicep curls for your brain, right? And one of the more practical things to learn is cooking. Learning to cook in a healthy way is a great way to stimulate your brain. It's executive function. You've got a plan. You got to maybe look through cookbooks or look online at recipes and then go out to the store and get the things that you need. And maybe you're shopping in a different way because you're buying new things. Then you come home and you prepare it. And hopefully you get to enjoy it with people that you love. But that process, that executive function of planning and then executing, that is great stimulation for your brain in a very practical way that allows you to maintain independence and ultimately maintain dignity, right, as we age. So I highly recommend doing things like that are very practical, right? If you do more Sudoku or you do more crossword puzzles, you might get better at doing those things, but really engaging in practical activities that will support you as you age. I put a premium on that. The other thing I put a premium on are things that are fun. Because if you enjoy it, you're much more likely to continue to do it. So if you've been a dancer and you love dancing, well, then go back to dance classes, learn a new type of dance. If you have been a musician, maybe you go back to, or I highly recommend staying engaged in that. If you're in your 20s and 30s, if you're in your 40s and 50s or 60s and, kind of in the post raising kids phase, go back to the piano if you played the piano, or start a new instrument, learn new songs, go back to familiar songs, whatever you enjoy. I had a patient recently, she came in and she was telling me that her and her husband were having a conversation, that they were empty nesters, and she was feeling like her cognition was slipping. Her dad's in memory care. Her mom's passed away with Alzheimer's. So she was worried about it herself. And she and her husband were having a conversation. And she said to him, I don't remember having fun. The last time I had fun was when I was riding horses as a teenager. And he was like, all right, let's get you back at it. And she started like show jumping and doing she got super into it. And now she travels around and she has this whole new community that she's involved with. And she's super excited about the horses. And she goes to the barn and takes care of them. And it's just this whole thing that she's really excited about and into. And she's committed to it because she enjoys it. Right. So if we're having fun, we're much more likely to stay involved. And I don't think, if you weren't into horses, I wouldn't say go start show jumping. Right. And I'm a little bit nervous about her falling off a horse and getting a traumatic brain injury. But for her, that's this expression. That's part of who she is and part of what she loves. And so what is that for you? And it might be a little bit unexpected, but what are your hobbies essentially? And can they be non-toxic? Right? So I do worry, people who golf and are out on there's a lot of pesticides and herbicides that can be associated with that, or people who work on cars, they can be exposed to like the petrochemicals. But I tend to encourage things where you're not going to get a traumatic brain injury and you're not going to expose yourself to a bunch of chemicals. But as long as you're having a good time, yes, exercise your brain, learn new things, do things that are fun and enjoyable and social.
Yeah. Well, I've recently taken up golf, so I might have to rethink rethink the sport I'm going to learn next. What are some of Dr. Heather Sandison's red flags when it comes to cognition? Some things you would maybe see in someone's routine and say, absolutely no, this is one of the worst things you can do for your brain.
Yeah, I mentioned sleep deprivation, and then dismissing sleep apnea. So I've had several patients diagnosed Alzheimer's who have single digit Mocha scores, so quite advanced, and they get their sleep apnea treated, and all of a sudden they're back. One of them went from an 8 to a 16, one went from an 8 to a 15. So really noticeable changes in cognition, really basically just treating sleep apnea, not doing a whole lot more. Although we worked on other things, that I think was the single most important intervention. So, and these are women who no one told them they snored because either their partner took his hearing aids out at night or their partner had passed away. And so we didn't have a reason to really think they had apnea, but lo and behold, they get the testing, severe obstructive sleep apnea. So I highly recommend anybody with waking up tired or with any cognitive decline, get tested for sleep apnea and aggressively treat it. Even if it's only mild sleep apnea, restricting blood flow to the brain while we're sleeping is going to prevent you from getting the deep sleep and the REM sleep that are so crucial to brain health. So red flags are waking up feeling tired in the morning, being sleep deprived, getting less than 7 hours of sleep at night, high blood sugar. So like right now I'm wearing, you can't see it, but I'm wearing a continuous glucose monitor. These are now in the US, they're available over the counter through Stelo, Stelo. And that is a great way to learn so much about your body's metabolism and how high your blood sugar is getting regularly, because high blood sugar becomes toxic to the brain over time. It literally can change the cells. Advanced glycation end products start to pop up. And then also as we age, regardless of our diabetes status, we become less sensitive to both insulin and glucose. So we're not as good at turning glucose into ATP, or the fuel our cells run on. And so that's why part of why we recommend getting into ketosis is to lower blood sugar, but also because we use this alternative fuel source that is associated with less oxidative stress, that promotes detoxification, that reduces inflammation, and where we more efficiently create ATP, or that energy for the brain. So if you notice that your blood sugar is creeping up, that hemoglobin A1C or your fasting blood sugar is creeping up, that is a red flag. That's a big red flag. High cholesterol, also a red flag for dementia. Mercury level, so toxic metals, mercury, cadmium, lead, these can affect cognition. Also chemicals can affect cognition, chemical toxicity. Glyphosate in particular is very hard on the nervous system. That's the chemical found in Roundup, the weed killer. And then toxic mold. So indoor mold can have toxins associated with it that affect cognition. And so taking that seriously. So if you know that you live or work in a moldy or water damaged building, even just going away for the weekend, getting out of that environment and seeing, does my cognition improve? Does my health improve? Does my sleep improve? Just noticing the difference when you're not exposed can help to sort of inspire people to take action and get out of a moldy environment. There's so many different things that we could talk about here. But a sedentary lifestyle, I mean, the red flags, really those early warning signs are misplacing things, poor judgment, not being able to find words, missing appointments, those kinds of things are those early warning signs. And often the patient won't be the one that notices them. It'll be the adult daughter or son who's like, Mom, what's going on? And kind of needs to bring her attention potentially to everything she can do to optimize her cognitive function.
Well, one of the final topics I'd love to get you to speak on, and I have to caveat this by saying that when I'm talking about supplements, I'm not, because this is counter to what we've been talking about. We've been talking about lifestyle factors, those types of interventions. But I know a lot of people out there probably look at things like supplements, and they, as you mentioned earlier, you alluded to this, they're looking for the magic pill, right? They're looking for something small and easy to do that can give them all the benefits of the hard work they're avoiding. That's not what we're talking about here, because I know a lot of people in this audience who are obsessed with optimization. They want to get that 1% better. They want a 0.1% better even. Are there any supplements then that we can point to say this is undeniable in the benefits it will give you in terms of cognition? Is there a sort of budget level then supplement stack we could put together? What are some of the supplements you would point to, if any at all?
Yeah, Luz, this is such a great question. I want to share just one more quick patient story because this is applicable. So supplements can be this easy win. And when we need that motivation, right? If we can give somebody a supplement, melatonin is associated with reducing Alzheimer's risk. It's a great antioxidant. If I can get you to sleep faster and you get better sleep, you get higher quality sleep, you don't have to take a benzodiazepine that's associated with as well as, antihistamines have anticholinergics. Sorry, I just went in multiple directions because you got me so excited here. But so many of the things that we take to fall asleep are actually bad for cognition. So things like Benadryl or the antihistamines, they are also anticholinergic. So they come with some risk when it comes to cognition. Benzodiazepines, things like Ambien, Valium, that class of medications that often is used to reduce anxiety and help us get to sleep, bad for cognition. So what are some alternatives? Well, melatonin is a great one. If I can get you better sleep and then you have better energy in the morning, and now you can make that phone call to your loved one who you want to spend time with and you're less socially isolated, or you have the energy to now go for a walk in the morning. You have the energy to now make better dietary decisions. That's a win. That's huge. And sometimes supplements are a great place to start. Also, I have this wonderful patient a client who I was talking to his daughters last week, and he's in Spain. And he has this incredible life. Like, he was very successful. He now lives in, I think, his parents' place in the center of this town in Spain. And he goes out and goes for a walk, and he gets the paper, and he has his coffee, and he has drinks in the afternoon, and he knows everybody in town, and his friend makes pastries. And the thought of, and he fights with his daughter when he needs to go get exercise, and he thinks that he rides a bike, but he hasn't ridden one for many years, right? And the thought of me saying that he needs to change his lifestyle is like sort of heartbreaking. Like he's just living his best life in this phase. And yes, he has dementia and it's progressing. But when we think about what are the levers that we can pull, this guy's in his late 80s. Like, do I really want to force him to get 200 minutes a week of exercise when it's already like he's resisting it already? Do I really want to force him to get into ketosis when his friend from high school is making the most amazing pastries? Probably not, but we can get him some supplements that might actually make a difference. Okay, so I'm going to give you like my top 3 to 5 supplements for this. And a lot of what we do is precision based, right? So it depends on the person. If somebody has high levels of mercury, we need to go after the mercury with specific supplements, and we can do that effectively. If somebody else has high mycotoxins, we're using entirely different things. But generally speaking, what are some supplements that we can use to optimize cognitive function? One, there's a product I like, a nootropic stack called Qualia Mind, Qualia, Qualia Mind. And this is put together by some friends of mine. If you look on their website, I used to host their podcast. I don't make money from saying this, but I love that product. It's a very sophisticated product that's very well thought through, that helps to both increase neurotransmitters associated with focus and mental clarity, but also helps with metabolism. And personally, when I take it, I feel more articulate during the day and I sleep better at night, even though there's some caffeine in it. So it has a little bit of stimulant in it. So that's a great one. Then fish oils, I think, make sure that they're mercury free, but fish oils are helpful for reducing inflammation, certainly, but overall, you just see benefits in so many things. Vitamin D. Vitamin D is a signaling hormone. We call it a vitamin, but it is a signaling hormone, and there are receptors in the brain, also in the bones, of course. If you're not on a blood thinner, you can add vitamin K2 to that. So D3 and K2 together. But if you are on a blood thinner, talk to your doctor before you take vitamin K. And then sometimes a greens powder. If you're not eating a ton of greens, just getting a greens powder in can be really helpful. A probiotic, particularly if you have any gut issues, but a probiotic can be helpful. The gut-brain connection, we could talk for days on that alone. But just taking a good high quality probiotic and maybe pulsing it, right? Take it for a month, take a couple months off, take a different one a couple months later, and just eating fermented foods, sauerkraut, kimchi, kefirs. Those are all things that can help and benefit. Now, olive oil, just like a tablespoon of high polyphenol to olive oil reduces the risk of dementia. Coconut oil is another one. Coconut oil includes a high level of MCT, medium chain triglycerides. So consuming coconut oil, go slowly because it can lead to diarrhea, but a teaspoon, maybe once or twice a day, separated to start, and then going up in tablespoon doses daily. That can provide the backbone of beta hydroxybutyrate, one of the ketones that your brain can then burn as fuel. So hopefully that's helpful. Just a few ideas.
Yeah, amazing. So I've got Quality of Mind, fish oil, mercury free, vitamin D and K2, greens powder, probiotics. Olive oil is one that was kind of new to me. And Stephen Gundry tends to send me a big bottle of his polyphenol oil every year and a couple of shot glasses. I've yet to try them in the shot glass. I normally cook with it, but yeah, taking shots of olive oil seems, I'm a little bit, nervous.
It's funny that you say that. I saw Dr. Gundry recently, and he gave me a bottle of his polyphenol olive oil, and I crave shots of olive oil. So I'll do that pretty regularly. My body will crave it, and that peppery taste. It's so yummy. But yeah, there's olive oil clubs where you can get them from all over the world. Olive oil and honey are two things. So honey will not keep you in ketosis. I'm not, but I do love honey. It's my favorite sweetener. That and maple syrup are my favorite sweeteners. If you are not aiming to get into ketosis, but olive oil and honey they are highly contaminated. So there's a lot of counterfeit in that world. And so making sure that you're getting really good, high quality, you're not going to get the same benefit. And then you want to get your oils in glass. Avocado oil is another one, especially if you're cooking, that'll tolerate a higher heat. So I don't recommend cooking with olive oil, but cooking more with coconut oil, butter, ghee, and avocado oil.
I'll have to break out the shot glass that he he gave me and give it a go there. Amazing.
I
Well,
recommend it. Let me know what you think.
I will. Well, we sign off every podcast by asking any guest that comes on the show the same question, irrelevant to the topic or experience of that person. And that question is for Heather Sandison right now, what makes life worth living?
Oh, my daughter, she's 5, and she is just, it's the privilege of my life to be her mom.
Beautiful. I love how you didn't even have to think about that. It just came straight out.
Yes, there's no question.
Amazing. Well, for everyone who's been listening to this podcast, watching this podcast, and they want to find more from you, they want to check out the book, of course, but they may want to follow you on social media, find out some of your other works and projects. Where's the best place for people to connect with you?
drheathersandison.com. You can sign up for my newsletter. We'd love to have you. We keep everyone up to date on the research and share tips and tricks on optimizing cognitive function there.
Amazing. I will leave all the links below to your website, your social media, and the book, of course, for everyone to check out. Heather Sandison, thank you so much for joining me on the Freedom Power podcast. It's been an absolute pleasure to speak to you.
Lewis, thanks so much. It's been a privilege.